slump test, you're testing for dural tension within the body. We're going to be placing the entire dural system on tension, and so if the patient has a herniated disc or nerve compression somewhere along the line, this test would be considered positive, as it will elicit their symptoms fairly quickly. So for this test, you're going to ask the patient to come into a sacral sitting. So you're going to say, go ahead and slump down for me, really round your back. And then if that feels okay, you're going to ask them to bring their head into that flexion. And I tend to have a hand here very gently just to keep them in that flexion. And if that feels okay, then you're going to ask your patient to go ahead and uncross your legs for me. And then you're going to start with the non-symptomatic side. So go ahead and just straighten your right leg out and then pull your toes up towards you. And if they can get into this maximal position, and go ahead and relax, then you can be fairly sure that they have normal functioning dura and there aren't any adherences or any irritants along the way. If they do have a positive sign, so go ahead and bring your foot back up. And let's say they get pain as they start to pull their foot up, you can sensitize the test and say, well, is it hamstring or gastroc that's causing it? Let's bring the neck out of flexion. And if their pain goes away, we didn't change anything in through the leg, and so you know that you only were affecting the dural structures, the nervous tissue, and so that would be considered a positive for dural tension, and potentially for bulging disc, nerve root adhesions, that sort of thing.